Hey everyone, Dr. Shook here. I hope you're doing well today. Today, what we're going to talk about is one of the most overlooked drivers of Hashimoto's that I see in clinical practice. And I'm going to walk you through exactly how this happens, how blood sugar fluctuations, both high and low blood sugar, create major problems for autoimmune conditions and especially for Hashimoto's. I have seen people that I've worked with where we fixed and focused on improving their blood sugar balance, and it improved their symptoms by 50%. So this is something that it has a high potential to make a positive impact on the autoimmune process and how you feel. So this is something that is critically important to understand. So let's get right into it. I like to always start these videos by talking about Hashimoto's and the autoimmune disease process because it is not a thyroid problem. The thyroid is attacked by the immune system. This is primarily an immune system issue, and it is a multiple system autoimmune disease with several vicious cycles with other systems of the body. So the immune system is involved. It affects the endocrine system. It affects the blood sugar and glucose regulation. It affects the liver. It affects the GI tract. It affects the nervous system. It is a multiple system autoimmune disease, and that is the most important thing. That if you understand that, you are going to have a much higher potential for improvement of your condition. So today we're going to talk about one particular vicious cycle that we commonly see, which is the Hashimoto's and blood sugar web. Now, as I mentioned, there is also a neurological web. There is a gastrointestinal web. There's an endocrine web or vicious cycles that occur. There are immune webs, of course. That is the primary issue with Hashimoto's, is the immune system. But all of these systems, they break down and they contribute to further driving this autoimmune process. And I have videos just like this on each one of these webs. So it's really important if you're trying to really improve your Hashimoto's or improve any autoimmune condition, you will very commonly see these particular interactions between systems or physiology and the autoimmune process. Now, what I want to go over in this slide and in this diagram, if you're listening on um, any of the distribution channels where it's just audio, you can go to YouTube and watch this long form video. You're going to be able to get a lot out of it because of the diagrams. I'm going to walk you through, so it should make sense, but it's even better if you can see this visually. We have a lot to go over today, so I'm going to go fast. If you need to come back to this, please just come back to it. But I've got a lot to cover in under 30 minutes. So what we're going to talk about is Hashimoto's and the blood sugar consequences. And I want to talk about how Hashimoto's and this autoimmune process and the hypothyroidism that occurs can have very negative impacts on your ability to control and regulate your blood sugar. So we're going to talk about how it impacts high blood sugar and low blood sugar. So, one of the things that happens when someone has Hashimoto's and this hypothyroid impact occurs, you will have decreased ability to respond to your insulin that is in your bloodstream. So, this means that you're going to have decreased cellular response to insulin. So, if you don't know this, insulin is a hormone that's made by your pancreas. One of its primary jobs is to stimulate your cells to take blood sugar that's in the bloodstream into the cell. Now, when this occurs, that lowers your blood sugar because the blood sugar is no longer in the bloodstream. It moves into the cell and out of the bloodstream, and the blood sugar comes down. So, whenever you have this Hashimoto's autoimmune process that's occurring and the hypothyroidism, it diminishes and lowers the ability of your body to respond to insulin. So those cells have little receptors on the surface, and when insulin attaches to them, it doesn't respond the same. And this actually impairs a cellular transporter. So the thing that it's called the glut transporter, and it actually is inside the cell, and it moves to the cell surface, and it actually opens up and pulls the glucose or the sugar from the bloodstream into the cell. This impairs this transporter. So it does a lot of different things to the cells that make the body less able to utilize the sugar that's the glucose or the blood sugar that is in your circulatory system. So you can see how someone that has Hashimoto's, they're going to have a harder time lowering blood sugar, and regulating blood sugar. Now, this can also, you can have some other issues. We're going to talk about the hypoglycemia or the lower blood sugar impacts in just a second. But right now, this is how it can actually cause problems lowering blood sugar. Now, what this does when your cells cannot respond and cannot lower blood sugar, it increases your susceptibility to insulin resistance. Now, insulin resistance is where your cells just don't respond to your insulin the same way. And this can be due to too much insulin, but in this particular case, it's typically due to poor thyroid hormone stimulation of the cell or inflammatory levels that actually diminish the cellular response. So, due to the inflammatory process itself. Now, when you have this insulin resistance that occurs, your body can't respond to the insulin. It leads to hyperglycemia or high blood sugar. So when you have high blood sugar, one of the things that occurs is that the glucose, that's the sugar in your blood, that's what we call sugar in the blood, is glucose. It attaches to proteins of your tissues. This is actually called, and this is a little technical, but I'm not going to baby talk you. I'm actually going to talk to you about real physiology and real science, and I'm going to explain it in a way and hopefully lay it out for you in a way that's easy to understand. And we could skip some of these steps, but I want to give you a little bit more information about what happens here, because this is probably something you haven't heard about before. So when the blood sugar goes high, your blood sugar, the glucose that's in the circulatory system, it attaches itself to proteins, your tissue proteins, and it will bind to these proteins. And when it does this, initially it's called a Schiff base. Now this is something that is temporary, that can be undone, but once that glucose stays attached to that protein, it rearranges into an amidori product. Now the amidori products are more permanent changes to the tissue, to the sugar plus protein complex that occurs. And what this does is this leads to a lot of negative changes in the tissues. It leads, and you have other chemical processes like oxidation, where it loses electrons, and it can become dehydrated and fragmented. The tissue, the glucose protein complex, can become broken, and it damages basically your cellular membranes and your tissues. Now what this does is this creates something called an advanced glycated end product, or AGEs is how it's referred to. Now you may have heard about these before. If you haven't, this is what high blood sugar will do. When they measure your hemoglobin A1C and they look at your red blood cell, and they tell you, hey, this is your score for your A1C, which is a measure of blood sugar fluctuation over a 3-month period. This is what they're evaluating. They're evaluating these advanced glycated end products, or AGEs for short. Now, these have some really negative consequences. When your AGEs, or these advanced glycated end products, go up, it stimulates, you literally have these receptors in your body that are on your cells that are called rage receptors. Now, it doesn't mean rage, like, get into a fit of rage. It means it's the receptor for advanced glycated end products. That's what it's an acronym. Okay. And when you have these advanced glycated end products due to high glucose, it actually binds to these receptors, these rage receptors, receptor for advanced glycated end products, and it stimulates an inflammatory reaction. This drives inflammation. Now, what happens here is this stimulates a pathway called the NF kappa B pathway. This is a well-known inflammatory pathway. When this occurs, it stimulates another inflammatory pathway that drives the autoimmune process. This is called the Th17 pathway. And this drives autoimmune activation and will promote autoimmunity and will promote Hashimoto's. So this is how blood sugar is not just related to blood sugar levels. It's not quite that simple. It actually stimulates the immune response that can actually promote the autoimmune process. So in addition to doing having a lot of other negative impacts. But this is why, if you have Hashimoto's, if you are neglecting the blood sugar component here, and this is not necessarily just like changing diet. You have to address the inflammatory pathways here. You have to make sure that the thyroid hormone production, the levels, the transportation of the thyroid hormone, the sensitivity at the cell, and the detoxification of the thyroid hormone. 4 phases of all hormonal physiology: production, transportation, sensitivity, detoxification. You have to make sure that is working properly. You have to support not only with diet, but you have to do things like get adequate sleep. If you don't sleep, you will decrease your insulin sensitivity the next day. If you wear a continuous glucose monitor, which by the way I recommend, now they're available over the counter. You can get them like 4 weeks for about $99. I highly, highly recommend it. Everyone that I work with via telemedicine, I always recommend these. You should get these because you will have a unique what we call phenotype. It's how your genes plus your diet express in your blood sugar regulation, and you will have a unique fingerprint of how your body regulates its glucose or the blood sugar. And you can see that with a continuous glucose monitor. So there's a lot we can talk about here, but this is why you all of these vicious cycles that I teach, you have to address these. This is where taking a thyroid hormone replacement and thinking that this is going to be the answer is completely naive. And your doctors don't know this stuff. They don't know this because you know what you need to tell them? You need to tell them to go to the Karazian Institute, sign up and take the classes. Learn from Datis Karazian. I have his information, Karazian Institute. Go there and learn this information. I've been studying Datis's work and I've bone fortunate to learn from him for over 15 years. I've taken every class he offers. I've taken every class at the Karazian Institute. I've taken every one of the clinical mastery courses. I am three courses away from completing everything that he's taught. I've taken every class. So very fortunate because this is based on a lot of his work, and he's a fantastic educator, an incredible teacher. And if your doctors just got a little bit of education on this, it would change the way that they practice. I think you could be empowered as a primary care physician, PA, NP to either refer people to information or whatever. You don't have to master it, but you just know that lifestyle impacts this. And if 9 out of 10 people that have a low thyroid have Hashimoto's, it's important. It's important that they understand that and that they can just say, hey, you have a low thyroid. I can't check your thyroid antibodies because it's not medically necessary under your insurance, but you might want to get those checked. You can go self order. You can go to like my website. I allow people to self order for under $100. You can get a full thyroid panel, thyroid antibodies, just about anywhere in the country. There's a few states that won't let you do it, but anywhere in the country, self order. You don't even have to talk to me or anyone else. And the company will send you a kit. You go to a lab, get it drawn. You can find out what's going on. But your doctors need to say, hey, there's all these other things that are important. Go to this website and learn. Consider an autoimmune paleo diet. Consider a clean ketogenic diet. Just refer them to my website, drbradshuk.com/resources. I give all that stuff away. So let's go into the next part of this physiology. I'll never get through all this data. I got to get through this in about less than a little bit more than 15 minutes we have. So we're going to move fast. Come back to it if you don't understand it. Okay, on the other side of the equation with blood sugar and glucose, with Hashimoto's, there is this issue with hypoglycemia, low blood sugar. Low blood sugar drives this too, just slightly differently. It has its own negative effects and negative cascade of things that occur. So with Hashimoto's and hypothyroidism, you can also have a decreased or reduced rate of glucose absorption in the gut. So when you eat food and it breaks down, it may not absorb well into the bloodstream through the gut. You can also have a reduced rate of glucose uptake by the cell, this can have to do with metabolic rate too of the cell with the thyroid hormone, not just with the inflammatory pathway. And then you also get a diminished cortisol and insulin response to low blood glucose. So when your blood sugar gets low, your body will stimulate the production of cortisol to is one of the hormones, the catecholamines, which we'll talk about in just a second, and that stimulates processes where the body will break down proteins like muscle, or it will liberate stored blood sugar from the liver and your skeletal muscles. So it can break down proteins. It can also liberate stored blood sugar that's called glycogen from your liver and your skeletal muscles, and it does this into the bloodstream. Well, with this with this increased inflammatory load and with a decreased thyroid hormone physiology. So maybe you don't have enough of the hormone, the production. Maybe you can't transport it well. Maybe you have decreased sensitivity of your cells to your thyroid hormone because of inflammatory load, because of vitamin A deficiencies. Many different things could do it. You have a diminished response to your insulin, and so to the insulin that your body makes. So when your blood sugar gets low, you're going to have a stimulation of these hormones, but you're not going to respond to them normally. You don't have a normal response. So what this does is this increases your susceptibility to low blood sugar, because if you can't absorb your glucose in your digestive tract into the bloodstream, you can't get it into the bloodstream, then you're not going to be able to raise your blood sugar efficiently. If your cells can't take it in, then you're going to have a greater chance of having hypoglycemic like symptoms, because you're not able to utilize the glucose that's present. And if you have a decreased, cortisol and insulin response, you can't get the glucose into the cell. So you can have hypoglycemic like symptoms like low blood sugar, be more susceptible to low blood sugar, especially if you have dietary habits where you go long periods of time without eating. I can tell you my most challenging cases with blood sugar is people that are normal body weight, like like me. This is me with normal body weight, and they are not able to they don't eat frequently enough. Maybe they exercise a lot too, and maybe they drink stimulants in the morning, and so all these things lead to a greater propensity for increased low blood sugar. And so this is where these people, we have to get them eating frequently enough, typically proteins. And then sometimes they do better on ketogenic diets if they can get into ketosis. And when they're in ketosis, their body can burn off of fat. They can eat more fat, which is more calorie dense, nutrient. It's more dense in calories, and it will raise their ketone levels, and that will help to. It's anti-inflammatory, but it also helps to diminish these hypoglycemic events because they're using ketones and fat for energy. So that's a little bit more of an advanced tip there, but that's one of the things that can happen. So what happens when you have these low blood sugar like events, or you can't use the blood sugar? You get these spikes in your stress hormones. These are called catecholamines. Catecholamine surges. They're released from your adrenal glands on top of your kidneys. When this occurs, you get spikes in adrenaline, spikes in cortisol, and what this does is this stimulates those pathways where your body breaks down muscle and turns the protein in your muscle into sugar. That's glyco neogenesis. And then when it also breaks down the stored blood sugar, if you have any sugar that's stored in the liver or the muscle, in that's your glucose, your blood sugar, when it's stored in the muscle and liver, that's called glycogen. Now, glycogen is broken down through um, another pathway, glucogenolysis. And anyway, so there's basically, it's where it breaks down, your body creates sugar due to spikes in these stress hormones from your muscle, which will make you skinny and make you fat at the same time, and then also from your liver and your skeletal muscle by releasing glycogen. So it's not a good thing to have happen chronically, because this also raises cortisol, and when you have high cortisol, that suppresses melatonin. That can cause problems sleeping. That can cause problems with insulin sensitivity. That can suppress your immune system. It can lead to a ton of problems. Plus, it spikes increases in interleukin 17. Hey, buddy, come on in. So my cat, you hear my cat crying? Come on, bud. Come on. Come on. He's a Siamese, so he'll talk unless I let him in. Um, so he ate. Hopefully he's not going to. He's not. Hey. No, no, no. Don't jump up here. Sorry. No, no, no. No, no, no. Lay down in your bed, bud. Lay down. Lay down. Yeah. So it also creates issues with increases here. I just on the diagram, it spikes a inflammatory pathway or chemical messenger called interleukin 17. Now, interleukin 17 is a cytokine. It's made by the immune system, but these spikes in catecholamines do this. That drives the Th17 pathway and drives autoimmune activation. So both low blood sugar and high blood sugar will drive this process. You have to address these. There are strategies that you have to incorporate. You have to address them. And we have 11 minutes to get through a lot. So let's go. So how do you address these issues? Well, I gave you some tips there. When you're looking at autoimmunity, this is the model that I use. I think this is I don't know of another evidence-based model, but this is a model that's been developed by immunologists. This is a model that's been refined in clinical practice. Dr. Karazian uses a lot of this, teaches a lot of this. Aristo Vojdani is a fantastic teacher. Elroy Vojdani, his son, bunches of people, lots of people have contributed to this. It's not just them, but they're some of my greatest influences. And this is a fantastic way for me, and I like to teach people this model because a lot of folks think that there's nothing that you can do for autoimmune disease, and that's not true. You can do a lot. and there are many things that you should be focusing on. So this is the environmentally induced model of autoimmunity. It's called a triad because there are three different areas. The first area here is barrier breach. So you have immune system barriers. Your intestinal lining is an immune barrier. It's a selectively permeable barrier. When it breaks down, it lets inflammatory things into the bloodstream, can drive the autoimmune process, can be a trigger and driver. Your blood-brain barrier is critical. Your lung barrier is critical. Your nasopharynx, your oral health, and your gum health, those are all, everywhere you have a mucous membrane, that is a selectively permeable barrier. Your skin is a barrier. A lot of people that have psoriasis, eczema, that have issues like that. I have psoriasis. It's actually what got me into functional medicine. You have to try and heal those barriers, and you use topicals on the skin a lot of times while you're healing the inside, because that's how you actually improve those conditions. But you've got to heal these barriers, support healing these barriers. You can assess them through testing. You can then put together protocols, dietary, lifestyle, supplementation to support them, and then you can retest to see where you're at. The next thing are environmental triggers. Now, the environmental triggers is a huge category, but there are three general columns of things to think about here for environmental triggers: food protein reactivity, food allergies, food sensitivities, food complement protein reactions. Basically, any way the immune system can react to food proteins, it can be a trigger and driver of the immune response and the autoimmune process. Pathogens, okay, that's the second thing here is triggers. Pathogen is an umbrella term for bacteria, viruses, parasites, fungi. These are known in the scientific literature. This stuff is all in scientific literature. They're known to be triggers and drivers of the autoimmune process. So we want to try to work them up, understand if they're present. If they're present, remove them, and then support healing the damage as much as we can. So that's important. The third general category are chemicals. Chemicals wreak havoc on the body many, many different ways. They do trigger the immune response. Not many people are aware of this. Not many clinicians are aware of this, but chemicals can bind to tissues, creating a new complex of chemical plus tissue that is foreign to the immune system. The immune system will react to it and it can drive autoimmunity. Chemicals also can mimic hormones. They can stimulate your cells as if they're estrogenic, is the most common one. They can block receptors so that other hormones in your body don't work as they should, because they can't stimulate the cells because chemicals are blocking them. They are many of them are carcinogenic. Many of them are bioaccumulative. They build in the tissues. Many of them are they can stimulate the cells so that your glands produce more of a hormone. I mean, just name it. They wreak havoc on the body in many different ways. That's why if you can eat organic foods, that's great, because you can reduce your exposure. If you have great water filtration systems, that's great. If you screen all of your cosmetics, your personal care products through like an app like the Environmental Working Group, or I think Think Dirty is one too, that's great. You've got to reduce your exposures to these things. Anyway, the third category that makes up this triad is immune system dysfunction. And this is a broad term too, a broad category too, but vitamin and mineral deficiencies that are present that decrease the ability of the body to carry out normal physiology can definitely be a factor here. The fat soluble vitamins A, D, E, and K are absolutely critical, very commonly deficient because of all of the cycles that occur in autoimmunity, these vicious cycles between the autoimmune process, the gut. And that's a huge one with these, because you can't absorb things well in a lot of cases. Chemicals can be triggers here as well. Stress because it activates the autonomic nervous system, which is your fight or flight and your rest and digest. But if you're chronically activating the stress, the autonomic fight or flight, you're going to have higher catecholamines. We already talked about how they drive inflammatory pathways, and they can promote autoimmunity. There are many things here that have to be also understood and addressed. Like I mentioned, sleep earlier, because sleep is critical. There's many things that we have to, relationships, community, what you can do here. This falls under a broad category. Okay, this is a slide. We're going to go fast. This is one you're going to want to pause and probably come back and read, because I'm getting ready to give you the structure and the overview of how, from a clinical perspective, that autoimmunity should be managed, in my opinion. And this is very important. So this is the clinical management of autoimmunity. There are 3 levels of management here. Level 1 is what level 1 and 2 is primarily what I deal in. And this falls under educational management, like what you're doing right now. You're educating yourself on autoimmunity. That helps you to understand the importance of something like blood sugar, which we're talking about today, which is absolutely critical. Most people have no clue that that's critical for their autoimmunity. So this educational component is huge. The people that do the best that I work with are well educated. They know what they're talking about. They've learned. They are becoming their own advocate. You have to do that. So educational management, lifestyle management, I already talked about, sleep, stress, dietary management. This is important. Antigen management. So that's the pathogens, primarily foods can fall under this. Chemical management. We talked about chemicals. Immune barrier management. We talked about the barrier systems. Immune tolerance management. Getting the right environment in the gut so that you're not reacting to everything that you eat. Then level 2 is managing flare-ups, because flare-ups will occur. You've got to understand, try to identify triggers, work through those. And then pharmaceutical management. Yes, pharmaceuticals have a place. I've worked with people that we can't dampen the autoimmune process no matter what. And that is because it's complex. It's very complex, and it's not something that is linear. And everyone's going to have different triggers, different genetic susceptibilities, and so that does happen. So let's go through these quick. Level 1, educational management, understanding that relapses and remission are part of the autoimmune process. We don't know how to cure autoimmunity. The goal is to dampen it, and if we're lucky, put it into remission. Foods, chemicals, pathogens, stress all contribute, and everyone has personal susceptibilities through genetics. Lifestyle management, relationships, stress, sleep, and exercise are also critical factors. They fall under that immune regulatory part, because they have major influences on the immune regulatory function. And so we could go through and map those out, different biochemical pathways, but not right now. Dietary management, the most common triggers we see: gluten, dairy, nightshades, lectin containing foods, salt. High amounts of salt with not enough potassium can be big problems, triggering the Th17 pathway. I could map that out. I've got videos. By the way, I have 750 videos on YouTube. So you can go and check those out. Food coloring can bind to tissues, be a new trigger. There are molecular mechanisms through which autoimmunity is triggered and driven. Molecular mimicry is one, where proteins in a food, for example, look like proteins in your tissue. So when your body makes your immune system makes antibodies against the food, it also can bind to your tissues, triggering autoimmunity. But blood sugar spikes, we talked about. Antigen management, I don't have time to go through all these. We don't have enough time, but you can come back and read them. Viruses, bacteria, we've talked about these pathogens, and these are the molecular mechanisms, molecular mimicry, super antigens, cryptic antigens, bystander activation. Chemical management, we talked about that some. Immune barrier systems, we talked about those. Immune tolerance is regaining tolerance to your environment. Active flare-up management, I have it listed here. You have to understand there are different protocols supplementation-wise you might use. There are important things you want to look at. And then pharmaceutical management, immune suppressive, anti-inflammatory, immune selective drugs, which I am not. I do not prescribe medications. That's something that we would want to co-manage with another doctor. So if you have questions, if you want free dietary guidance, if you want like the diet that I commonly use for people that don't have testing, that I don't work one-on-one with, you can get that free at drbradshuk.com/resources. That includes some lifestyle guidance in there too. And then the general supplementation protocol I might use with someone that has no testing, that has Hashimoto's. But it's always better if you have it in your budget, work with someone that's familiar with functional immunology, that can help you to identify these triggers, that has experience with the condition that you're working with, that can help you to work through it. If you have a budget for it, you want to do testing so you can get quantitative data on what your potential triggers are, and you can use those to formulate a bio-individualized plan unique to your triggers. Uh, that's something. I work with people via telemedicine around the world, across the United States. I've worked with people on every continent except Antarctica, and then in just about every state. So telemedicine is something I've been doing for a long time. If you need help, reach out. I will give you everything free that I possibly can. If you want to work one-on-one, go to drbradshuk.com/resources. You can go to my website and learn about completing an application for care. But I do appreciate you. Hope this has been helpful. Thank you for hanging out with me tonight. Please do check out some of the other videos. You can learn a lot. I'm trying to teach everything I know. So have a wonderful day. Talk to you again soon.